Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm continuing to talk about hypertension. Hypertension is a very common disease. 1.5 billion people across the world suffer from hypertension. In this country, 103 million people suffer from hypertension. In this country, 1 out of every 3 American adults suffer from hypertension. And in the Negro American community in this country, 1 out of every 2 adult Negro men and women suffer from hypertension. And what's sad about it is that a significant percentage, up to 45% of individuals with hypertension in this country, either don't know they have it, and they know they have it, and yet they're not being treated properly. Either not being treated at all or not being treated properly. And because of that, you have a tremendous amount of problems that are resulting from untreated or poorly treated hypertension, namely stroke, congestive heart failure, heart attack, kidney failure, glaucoma, because when you're hypertensive, your incidence of glaucoma increases accordingly. And this is a major problem. Last week, I took time to talk about the damage that hypertension causes to the brain. In this segment, I'm going to begin to talk about the damages hypertension, when it is not treated, causes to the heart. The heart, of all these multiple structures, is basically a big block of muscles with a lot of different structure within it. So when the blood pressure is elevated, the heart is feeling the resistance. It's pumping against a high pressure. And that high pressure is a resistance. And then the muscles of the heart, the fibers of the muscle, have a finite stretchability that they can tolerate. Once they reach to the max, they can't stretch anymore, then that's it. The heart, the muscle fail, the muscle cannot pump properly, and those individuals go into heart failure, which is one of the most common complications of heart disease for multiple different reasons. But I'm specifically talking about hypertension. You can't have hypertension for any serious period of time that's not treated properly without your heart becoming enlarged. And once the heart becomes enlarged, there are long lists of serious cardiac problems that can develop. But before I get to that part, I want to spend some time to explain to you how the muscles, how the vessels, the coronary vessels in the heart become affected by elevated pressure. Now, those vessels can become affected because of diabetes, high cholesterol, a whole host of other problems that can cause somebody to develop inflammation inside his vessel that can cause you to develop plaques. But the basic mechanism is really pretty simple. The vessels have multiple layers. The very first layer is called the intima. Nice and smooth. Has to be. Completely smooth and nice. However, when the pressure inside this vessel becomes elevated, nothing else is needed. The very fact the pressure is elevated, which was not meant to be. That's not the way God created it. That is sufficient to cause an aberration to develop in the first lining of that vessel. So far, so good. Once that aberration develops, it is no longer nice and smooth. So the bloodstream carries a whole lot of debris so that they can go out in our feces, we could urinate them out, and for that matter, we can exhale them out, etc. As the blood is passing through now, with the vessel that is no longer nice and smooth, one single little debris is going to get stuck to that area that's no longer smooth. Once that occurs, that automatically is being read by this little vessel as a foreign substance. And then that begins the process of inflammation, local inflammation. And of course, more debris is going to pile up. The more debris piled up, the more intense the inflammatory process, then that begins the formation of plaque. And as the plaque get bigger and bigger and bigger, it begins to narrow the vessel. As the vessel gets narrower and narrower, blood flow gets impeded, and you begin to develop ischemic heart disease. And of course, that's when the ischemic heart disease, that's when you're going to wind up with an acute myocardial infarction, i.e. a heart attack, because the blood cannot be taken to a particular part of the heart where it needed to go in sufficient quantity. Therefore, that area is not getting enough blood. And in any moment, you could have an infarct, which is basically something that ruptured in that area. And then, bingo, you have a heart attack. Okay? And both of these books that are in front of me, The Art and Practice of Modern Clinical Medicine, as well as African American Women's Health, there are at least 6 chapters on different aspects of heart diseases in each one of these books. And I explain these things in the greatest detail. So now you understand how ischemia begins to develop. There are, again, hundreds of other possibilities that can cause ischemia to develop, having nothing to do with elevated pressure. Believe me, no one knows these things better than I do. Because my role, what I do best, is teaching clinical medicine. To do so, you must understand the basic, no matter how minute it is, you must understand it because you're going to teach it. You're going to practice it. So therefore, that's the beginning of plaque formation. Believe it or not, something as simple as having teeth in the mouth that are rotted can cause ischemia to develop. You say, well, how so, Val? Well, when the teeth are rotted, there's an infection, an inflammation. The blood picks that up and carries it throughout the body. As it gets stuck, as it's passing through that infectious material that's from the mouth, is passing through the coronary vessel, it can get stuck there. As it gets stuck there, you begin the process of inflammation. That's why people who have bad teeth have a higher incidence of heart attack, because what I just explained. Doesn't matter where the infection is. It could be in your big toe. As long as it's an infection, eventually some of it's going to get dislodged. It's going to go through the rest of the body, and everybody who have chronic inflammatory diseases or chronic infectious diseases have a higher risk of having not only a stroke, like I talked about last week, to the same mechanism, also have a higher risk of having a heart attack, having nothing to do with elevated pressure. When you have elevated pressure, it compounds the problem. It makes it worse. So, therefore then, it is crucial that first of all, one diagnose the blood pressure, and then one treats the blood pressure properly. You have no idea how simple it is to diagnose elevated blood pressure. You also have no idea how simple it is to treat it. But you cannot treat it properly if you don't understand the basic, and then you don't take the basic into account. You don't interfere with someone's racial makeup just because you want to discriminate against them. Some people do that, but I don't. But you do it so that you can understand who it is that you are dealing with. I specifically use the word Negro for a purpose, because I am a Negro. You can't be a person of color and don't be a Negro. You have to be. You are an immediate African ancestry. All of us, human beings, started out in Africa somewhere. But for a reason that I'm not going to get into, some of us look externally differently. That doesn't mean that we don't have Negroid physiological situation in our bloodstream. And nothing, no disease makes that point more so than hypertension. Why? Because as I mentioned, this is show number 5. As I mentioned in show number 1, I will repeat it to you again. Many, many years ago, before my hair started growing, now they're all growing now, I sat on my kitchen table. In the beginning, when I was really writing articles like crazy, trying to make contribution, trying to get academically promoted, I'm just coming with ideas like you can't imagine. I said to myself, what is this hypertension thing? What causes it? I know that pheochromocytoma can cause hypertension. I know that renovascular obstruction can cause hypertension, but that's about total of 3%. What did that 97% came about? I said, well, I bet you since the human race began in Africa, when one looks at what the ambient situation is in Africa, the temperature and all the rest of it, and water being very scarce, how did people survive there? How did they manage to survive? And I say, I bet you there's a gene. There has to be a salt-retaining gene in the human body that enabled them to retain salt in sufficient quantity. Therefore, they can retain enough water, because wherever salt is, water is going to follow. That allowed these people to survive. However, we are now living in a new world. Being genetic, I bet you that gene was transmitted to the new world from our forebears in Africa. And sure enough, University of Washington and University of Virginia, there may be a few more, maybe one more university, decided, let's test this theory. They got kidney specimen from Caucasian American, Japanese American, and Negro American from Ghana. So they had 3 different sets of kidneys specimen. They grind these things up and sorted them out. And voila, they got to listen to this, they discover a gene called G protein coupled receptor kinase type 4. Let me repeat that. G protein coupled receptor kinase type 4. And that was published subsequently in the proceeding of the American Academy of Sciences, I believe in the year 2002. And it turns out that the G protein coupled receptor kinase type 4 was found in the same quantity and the same quality in all these 3 separate kidney specimens. The one from Ghana, the one from Caucasian American, the one from Japanese American. And then as a result of that, the revolution on how best to treat hypertension came into being. That is why you cannot treat hypertension properly in an individual with functioning kidneys without first start them with a thiazide water pill. What the thiazide water pill does, it goes to the distal convoluted tubules and block the reabsorption of sodium. Since it blocks the reabsorption of sodium, it prevents the sodium from getting back into the system, and it pushes it out into the urine, and water follows, and your pressure comes down. And of course, the powers to be, JNC7, in those days, I haven't heard from them lately, came up, which is an organization that supervises hypertension in this country. Then they step in and say, well, that being the case, then blood pressure in an individual with functioning kidneys must first be treated with a thiazide water pill. And I just tell you how it works. It's the cheapest medication you could buy. And the case is closed. No, the case is not closed, okay? Because first of all, many patients don't want to have to be going to the bathroom all the time to urinate. That's one issue. The second issue, since the blood pressure was so high, the water pill is necessary, but it's not sufficient to control the blood pressure. Here comes the Negro versus Caucasian issue, which is super important to differentiate. Why so? Well, if you are a person of color, slightly Negro person, there's a substance that the kidney produces called renin. All individuals who are not Caucasian have low serum renin. The kidney don't produce enough renin. That's the physiology. There are many differences, but I'm talking about physiologically, that's one of the key ones. And one of the most common medications that I use to treat blood pressure in this country, and for that matter across the world, is an angiotensin converting enzyme inhibitor. We call them ACE. Why? Because they can block the effect of renin. By blocking the effect of renin, they can lower the blood pressure. But if you don't have enough renin to block, that's not going to work. And there lies the problem. So you have to know what category of medications you could use in an individual of color, what category of medication you could use in a Caucasian individual. In a Caucasian individual, you could use any medication you want, except a beta blocker. Crucial. Beta blockers are not to be used to treat essential hypertension. Nobody could take a piece of chalk and go to the blackboard and come here for the audience to and show me how beta blocker works to treat essential hypertension. They cannot, because it doesn't. They like to prescribe that, but I'm telling you, it doesn't. Beta blockers are fantastic medication. Oh my God, they are necessary for a lot of things, but not to treat essential hypertension. If you have pheochromocytoma, yes, until you straighten this situation out, because pheochromocytoma is secreting a tremendous amount of adrenaline, and the beta blocker can block the adrenaline to prevent the pressure from going up. Yes, you could do that. But you cannot do that if you don't have pheochromocytoma, which very few people have. This is a tumor that is located, arises from the adrenal gland. You understand that? If somebody also has renovascular hypertension, the renin is up as well, then you could do that. You could do that. But you have to understand that if your kidneys are malfunctioning, you cannot use an ACE inhibitor, even though once your kidneys begin to malfunction, your renin goes up. The reason you cannot do that, if you use an ACE, it's going to cause the blood nitrogen to go up and the serum potassium to go up. So therefore, you cannot touch it. However, in a Caucasian person, you could do that because they have tremendous amount of renin. You could block it, blah, blah, except, of course, as I just mentioned to you, if their kidneys fail, can't use it even though they're Caucasian because the potassium will go up, the BO1 will get higher, so on and so forth. That is a crucial point. That's one thing to remember. So therefore, a Caucasian individual with functioning kidneys can use a beta blocker, can use an ACE inhibitor, can use an ARB, can use an alpha blocker, etc., etc. Okay? Problem is, if you were to treat hypertension with the secondary medication, which you have to know about, believe me, I'm going to get back to the heart, but I have to get this thing clarified. If you were to do so without a water pill, you could, if the dose is large enough, you could drop the blood pressure. But you can't do it long term because as soon as the kidney senses that the pressure is coming down and it wasn't being brought down with a water pill or being part of the treatment protocol or by water pill alone, it is the job of the kidney, my friend. There's a substance there in the kidney that's going to go up, and then you start returning salt all over again because this kidney wants to protect the body of all the things that the kidney does for us. One of the things that the kidney does is to also protect the body from collapsing, which is the theory that I talked about in the very beginning. Aldosterone is the last step in the renin-angiotensin-aldosterone pathway. So once the kidney senses that the pressure is going down, the kidney is going to raise the level of aldosterone so that aldosterone then raises the level of salt, the water comes back up, the pressure goes right back up. However, if you're using the water pill, this particular water pill, not just Lasix or Bumex, those are different things. They're good water pill, but they work in a different setting. I'll have plenty of time to talk about them. They work on a different part of the kidney. I'll talk about that too when the time comes. So you understand how important it is that everybody uniformly who has functioning kidneys, no matter who or what they think they are, must first get a Thiazide water pill. Then comes another difference, namely the racial difference. That is to say, what is going to be the second medication? Yesterday, another report comes out from the FDA that losartan by itself and losartan associated with an HCTZ from another drug company was just found also to become contaminated. Those fantastic, absolutely necessary medication. One more company just came out this week, again contaminated. So we can't use this. So now we're in a situation we cannot use those apps that are uniformly can be used in anybody. They are just magnificent medication. We cannot use them because they're contaminated, and then from a factory from China and India, and now they were decided whether to use them. Now we just get the report from the FDA this week. Another company just make an announcement. Their batches of losartan is also found to have impurity in them that can cause cancer. So we are in the middle of a crisis. Not only that, we had a crisis to begin with all these people that are hypertensive. Some 45% of them were not being treated at all. And those that were being treated, only a few percentage of them, close maybe 30, 35, maybe less, were being treated properly. Now you don't have this great medication that you could use to treat them. So you're left with calcium channel blockers, and you're left with alpha blockers, and you're left to twist and turn to diet this, cut the salt, this, cut the salt, that, and you are in an epidemic of obesity in this country. It's a challenge. All of a sudden, something that was simple now becomes very challenging to treat people's blood pressure. Right here. And no other company wants to come up front to try to create new medication. So we are in the middle of a crisis. But I'll get back to medication. I just wanted to make all this point. I'll get back to medication another time. Let's continue the discussion about the heart. So the vessel becomes clogged with plaques. The bigger the plaque, the less blood is able to pass through, the less oxygen is able to go and perfuse that part of the myocardium where it is scheduled to be perfused. So therefore the myocardium doesn't have enough oxygen, and it can infarct anytime, and you have a heart attack. Okay, so that's what blood pressure, again, tremendous number of other things can cause the same thing to happen. I'm talking about high blood pressure. And then once that happens, then you could have ischemic heart disease, started having anginal pain, shortness of breath, chest pain, difficulty walking long distances, etc., difficulty functioning properly, the heart is bad, then you got to get to see your cardiologist and get evaluated to see whether or not you're a candidate for some sort of surgical procedure that can even remove the plaque, or you may have to have bypass altogether, etc. It depends on the extent of the plaque and the extent of the symptom, etc. You have to do a cardiac cath to prove all that. So now you understand this is how hypertension is associated with the causation of acute heart attack. Let's say, for the sake of argument, you have hypertension, but the plaque is not big enough. Then you have to treat the hypertensive heart disease. And the treatment of hypertensive heart disease is completely different than the treatment of hypertension by itself. Hypertensive heart disease implies that the heart has already been damaged, and you have got to know what to do to treat this heart that's already been damaged by the blood pressure. The management is different, the symptoms are different, the prognosis are different, because when you have hypertensive heart disease, you are scheduled to develop heart failure, you are scheduled to develop severe cardiac arrhythmias, and you're scheduled, of course, to have a heart attack anytime. Okay? It is not the plaque that caused the hypertensive heart disease, it is the fact that the heart is now enlarged. Okay? And then once the heart is enlarged, those muscles don't contract. You can't make the heart larger and make it smaller at will. It doesn't happen. All right? It is serious business. Cardiovascular disease causes hundreds of thousands of deaths every year and several millions of deaths across the world every year. People are dying left and right. It used to be years ago that there was a decrease in the incidence of cardiovascular disease in the peasantry, where people ate sparse diet, a diet that was rich with fruits and veggies and so on. But because of the incidence of hypertension, it has now been discovered that has been negated, because these people, while they have a better diet than we do in the first world, because we eat all this fancy food, they didn't have the fancy food to eat, but they have other issues as well. Listen, I want to stop here until I see you again. This is Dr. Alcena saying so long and bye-bye.